Now the celiac trunk arises at T12 level from the abdominal aorta. It is a short stout branch of the abdominal aorta. After arising, it divides into three main branches. The first branch goes on the lesser curvature upward towards the esophagus. This branch is called the left gastric artery. Another branch goes posterior to the stomach towards the spleen region, and this branch is a tortuous branch to accommodate the distension of the stomach and also the filling of the spleen with the venous blood. So this branch is called the splenic artery. Another branch which goes right towards the hepatic region or liver region, this branch is called the common hepatic artery. So there are three major branches. First branch is the left gastric artery. Another branch is the tortuous one which goes posterior to the stomach towards the spleen called the splenic artery. Another branch goes towards the liver region. It's called the common hepatic artery. Now the common hepatic artery goes right like this and gives another branch which is called the right gastric artery. So the right gastric artery ascends in the lesser curvature itself and it's present in the right side of the lesser curvature. That's why the name is the right gastric artery. Okay. Now after giving the right gastric artery, the common hepatic artery again divides into two major branches. The branch which goes to the liver itself is called the hepatic artery proper, whereas the branch which goes downward to supply the pancreas and the part of the duodenum is called the gastroduodenal artery. Okay, so one branch goes towards the liver called the hepatic artery proper, another branch goes downward which supply part of the antrum, the duodenum and the pancreas. This branch is called the gastroduodenal artery. Hepatic artery proper again divides into the left and the right hepatic artery to supply both the lobes of the liver. The right hepatic artery again gives a branch called the cystic artery for the blood supply of your gallbladder. Clear? Now the gastroduodenal artery which descends downward again gives two branches. The branch which goes along the greater curvature of your stomach is called the right gastroepiploic artery, and the branch which goes downward again divides into two branches. The two branches, one goes anterior to the head of the pancreas and another one goes posterior to the head of the pancreas. So the branch which goes anterior to the head of pancreas is called the anterior superior pancreatico-duodenal artery. And the branch which goes posterior to the head of the pancreas is called the posterior superior pancreatico-duodenal artery. So the common hepatic artery gives branches like the right gastric artery, the two hepatic arteries. The right hepatic artery again gives the cystic artery, the gastroduodenal artery. Again the gastroduodenal artery gives a branch at the right greater curvature called the right gastroepiploic artery. Again the rest of the gastroduodenal artery descends downward, divides two branches. One branch goes anterior to the pancreas head called the anterior superior pancreatico-duodenal artery, and one which goes posterior to the head of the pancreas is called the posterior superior pancreatico-duodenal artery. Now have a look at the branches of the splenic artery. Now the splenic artery enters in the spleen at the hilum region. Just before terminating into the hilum region, the splenic artery gives a branch at the fundus of your stomach. Okay, these branches are short branches and these branches are called the short gastric arteries. Another branch of the splenic artery goes along the greater curvature of the stomach, like the branch of the gastroduodenal artery. This branch is called the left gastroepiploic artery. The gastroepiploic arteries are also called the gastroomental arteries because these arteries supply the gastric region along with the omentum, the greater omentum region. Now, the splenic artery also gives branches to the pancreas region. In the pancreas region, the head is supplied by the anterior and the posterior superior pancreaticoduodenal. Also, the anterior and posterior inferior pancreaticoduodenal, which are the branches of the superior mesenteric artery. I'll tell you later. Okay. So the head is supplied, head along with the onsenate process supplied by these branches. But the body is supplied, body and the neck region is supplied by branches of splenic artery. Splenic artery gives a branch called the dorsal pancreatic artery, which goes posterior to the pancreas, pierces the substances of pancreas and supplies it. This branch is called dorsal pancreatic artery. Another branch of the splenic artery goes downward, then divides into terminal branches, and the terminal branches run horizontally, and these arteries are called the transverse pancreatic artery. Another branch of the splenic artery near the termination is called the caudal pancreatic artery. This caudal pancreatic artery supplies the tail of the pancreas. And look, these arteries, the anterior superior pancreaticoduodenal artery, anterior inferior pancreaticoduodenal artery, dorsal pancreatic artery, caudal pancreatic artery, transverse pancreatic artery, these arteries anastomose with each other in the substance of the pancreas. So these are the arterial supply of your pancreas. Okay, and these are the overall branches of your celiac trunk. Now comes the superior mesenteric artery. The superior mesenteric artery arises at L1 level. It goes right like this. And the main aim of the superior mesenteric artery, I told you, to supply the midgut. And midgut includes the ileum jejunum part and also the cecum, appendix, ascending and part of transverse column. So the superior mesenteric artery runs obliquely like this and gives some branches. So the left branches are the jejunal and ileal branches. So 3 right branches, 2 left branches. 2 left branches are jejunal and the ileal artery, and the right branches are the ileocholic artery, right cholic artery and the middle cholic artery. The right cholic artery supplies the ascending colon, the middle cholic artery supplies the transverse colon. Clear? And the ileocholic artery mainly supplies the cecum and the appendix. The ileocholic artery again divides into anterior and posterior cecal artery, which supplies the cecum part and gives another branch called the appendicular artery to supply the appendix and gives some ileal branches for the terminal ileum. The jejunal and ileal arteries are present on left side and they form small branches which later on combine with the branches of the inferior mesenteric artery. These whole arteries of the superior and inferior mesenteric arteries form an arcade-like structure, and this arcade is called marginal arcade of Drummond. Clear? Now have a look at the branches of inferior mesenteric artery. I told you the main branches of inferior mesenteric artery is for your hindgut. Your hindgut starts from the distal 1/3 of your transverse colon downward, and it includes the transverse colon, part of the transverse colon, descending colon, sigmoid colon and rectum. Clear? Now the inferior mesenteric artery give a branch called the left cholic artery. Look, the right cholic and the middle cholic artery is given by the superior mesenteric artery, whereas the left coeliac artery is given by your inferior mesenteric artery. Now inferior mesenteric artery gives another branch to the sigmoid called sigmoidal artery, and also it gives another branch to the rectum called the superior rectal artery. Look, the rectum has three arterial supply. One is the superior rectal artery, another one is the medial rectal artery, another one is the inferior rectal artery. The superior rectal artery is a branch of your inferior mesenteric artery. Clear? The medial rectal artery is a branch of internal iliac artery, anterior division of internal iliac artery, and the inferior rectal artery is a branch of the internal pudendal artery. Clear? So overall these are the branches of the abdominal aorta and the branches of celiac trunk, superior mesenteric artery and inferior mesenteric artery. Look, the whole arteries of arterial branches of superior mesenteric and inferior mesenteric form some arcade-like structure, small branches. We supply the whole large intestine and small intestine, forming an arcade-like structure called marginal arcade of Drummond. And how to identify the jejunal and ileal branches of the superior mesenteric artery? It's simple. The superior mesenteric artery arises from this and goes like this. Okay. So the first branches are obviously small branches. As it progresses downward, the later on branches are the long branches. So the jejunal branches are the small branches. The ileal branches are the longer branches. That's why the jejunal branches have less number of the arcs, but the ileal branches have more number of arcs.